A case presentation on Dustin.
Hi, you've met with Dustin and his mom?
Yeah, do you have a minute to talk?
You bet, come on in. So, what have you learned?
Okay, so I just met with Dustin. He's a 7-year-old grade 2 student. He's had right ear discomfort for about 3 days. Mom thinks it's another ear infection. When I checked his temperature in the clinic here, it was 37.9. Mom says she gave Tylenol about 1 hour ago for a temperature of 38.7. She said his last infection was about 3 months ago, but he's had 10 cases of otitis media in the last 3 years. He's waiting to see EENT. Mom says the winter is worse for him. He had bronchiolitis 4 months ago, and he had it last winter. Mom also said that he had pneumonia at age 5, and he has no diagnosis of asthma. Today his throat was clear, but he's had strep throat 6 times in the past. His right TM was red, and there was no light reflex, and he had bilateral cervical adenopathy.
Has he missed much school?
Well, Mom says the teacher is concerned about how much school he's missed, and he's also had some recent inattentiveness. Mom said she's also concerned about a scalp problem because it's itchy again. On exam today, I noticed 2 loony-sized red areas with papules, scaling, and broken hair shafts. Mom says this is the 3rd time this has happened since school started.
So, what are you considering?
Well, I'm concerned about his frequency of illness and the papules on his scalp.
So, what would your top 3 or 4 differentials be?
Well, I'm thinking probably acute otitis media or otitis media with effusion, maybe a viral upper respiratory tract infection, alopecia areata, tinea capitis, maybe atopic dermatitis or psoriasis.
That's a lot to consider. Anything you learned from the history or the physical exam that might help you narrow it down?
Well, I know that he's a young male with a recent upper respiratory tract infection. He had diffusely red, non-mobile tympanic membranes today, and the fever and the pain would support acute otitis media. He also has a past medical history and school exposure that would support this.
Okay.
So I think acute otitis media or otitis media with effusion are more so likely than a viral upper respiratory tract infection. I don't think that the scalp issue is related to the ear pain. So for the scalp, I'm still thinking alopecia areata, tinea capitis, atopic dermatitis, or psoriasis.
So why do you have psoriasis on your list?
So my sister has it and it looks similar, but I'm really unclear about the signs and symptoms. What do you think?
Well, it's a consideration, but tell me what you're thinking. Tell me, what do you know and what else would you need to find out?
Well, I know that he's had 3 occurrences of the red, scaling, itchy scalp since he started school. His hair definitely lacks luster for his age.
Okay, and anything else?
So I know that to have tinea capitis, he would have had to be in contact with people or pets known to have a fungal infection. And for atopic dermatitis, he probably would have been exposed to a new detergent, shampoo, or cleanser. Tinea capitis is probably more likely than alopecia areata or atopic dermatitis because the itchiness, redness, papules, and scaling. Areata can occur in the very young, but this is rare and it's usually related to immune system problems or disorders such as hypothyroidism or stress. He also probably would have diffuse hair loss and no itchiness. I probably think I could rule these out.
Good. Those are all really important factors to keep in mind.
Should I investigate psoriasis further? I'm not sure I know enough about the differences.
It's always a good idea to do some research, but I think you've identified the top 2 concerns for today. These will give Mom enough to focus on at this point. Have you considered a return visit?
Well, considering how ill he is, I was thinking of having Mom and Dustin return to the clinic in 3 to 4 days for follow-up. Maybe other things are going on given his recent inattentiveness. And by then, I should be able to determine if and what further testing might be required.
So then what would you like to discuss with Dustin and his mom regarding management?
Well, for acute otitis media, I think that we'll try and decrease his pain I'll tell Mom that she can put a warm cloth on the affected ear and give Tylenol as needed. I would like to prescribe amoxicillin, and if there's no improvement in 3 days, I'll have them return to the clinic.
That sounds reasonable. What about for the tinea?
Well, I'll try selenium sulfide 2.5% shampoo. I can't see any recommendations for any topical lotions that work. In the meantime, I'll order a fungal culture of his hair and a KOH exam.
Good.
I'll also tell Mom to keep Dustin home for 7 days and increase his fluids.
Has Dustin had any allergy or asthma testing?
I don't believe so, but wouldn't the EENT physician look into that?
He should, but let's mention that to Mom as well for future consideration.
Okay.
Which brings us back to your thoughts on psoriasis.
I need to read up more about it. I'll do that tonight and I'll speak with you in the morning about it.
That sounds good. It sounds like we're ready to go in and discuss all of this with Dustin and his mom.